My name is Jade Veit, and when I was in 8th grade, I went through a traumatic experience where I became suddenly very ill and I had to be rushed to the hospital in an ambulance. I underwent a surgery to remove my appendix and then stayed in the hospital for around 5 days. So, as you can imagine, this would be a very, very expensive medical stay at the hospital. An ambulance ride can cost anywhere from $500 to $1,000. A 5 night stay in the hospital can be over $20,000 due to all the expenses, food, and medicines that you are receiving. And the average appendectomy costs around $33,000. So my medical bill would have been over or around $60,000. Now, for my family, we were very fortunate that my dad has very good health insurance because he is a teacher. So our insurance covered this, thankfully. But for a family in a lower class income, this would be very alarming and very scary for them because they might not have the same access to health care that many other people do. And they might not have enough money to cover these medical bills. So, Dymere and I will be discussing how the different social classes have different access to healthcare. A quote from one of our sources on the Commonwealth Fund states, "Do you want your teeth or do you want your heart to continue beating? You've got to figure out which one and balance it out. Sometimes I've had to omit the eyes and the teeth." End quote. No one should ever have to choose which health issue of theirs to address because they are all important and they should all be taken care of, especially when it comes to a mother deciding for her children. This is unfortunately an everyday struggle for people with lower incomes as part of the lower class. A lower class citizen has lack of access to good healthcare services just because of the income they are making. Middle class citizens have better access to healthcare and insurance, but still aren't as prioritized as the upper class wealthy Americans. And then when it comes to upper class Americans, they get the most preferential treatment and are prioritized in our healthcare system because of the fact that they have money. A person's income is strongly correlated with morbidity and also mortality across the distribution of income. That being said, these income-related health issues continue to rise over time. There are several reasons why this is, and several reasons why the healthcare system needs to fix it.
The first factor that one must consider when exploring how social class affects access to healthcare is affordability. For many Americans who are both insured and uninsured, healthcare is becoming increasingly more expensive. According to one study done interviewing 100 low-income patients, some of their concerns included costs, scheduling conflicts, and their general distrust of the healthcare system. Talking about affordability, when they were insured, deductibles could range from anywhere from $200 to $500, one patient said. Another concern that they have was not being told about additional charges that were being made for tests that needed to be run. Simply put, accessing healthcare services for low-income families can sometimes come down to a choice between their health and other priorities that they might have, such as providing for their families. Likewise, just as lower-class families have struggled with the cost of healthcare, middle-class families have also struggled with healthcare, and this has served to hurt their access as well. It was recorded that 1 out of 5 families struggle with medical bills, and that healthcare insurance has nearly doubled from 2001 to 2011. Notwithstanding with this, despite that, healthcare is a growing concern for both social classes. It most likely probably affects working class families more. Another factor to consider when thinking about how social class affects access to healthcare is scheduling conflicts. For families from low socioeconomic status backgrounds, it is often hard for them to get time off of work because they do not have sick leave. So missing work equates to losing valuable income hours for them as well as their families. Another difficulty for them in terms of scheduling appointments is not having times outside of regular hours where they can get an appointment, or having to deal with the fact that appointments have already been booked so that they cannot get access to an appointment for another 2 months. Another factor that was mentioned in the study that was mentioned previously is that a struggle that low-income families often have with the healthcare system is they do not trust their healthcare providers. They question whether or not their providers actually care. It was said within the study that a lot of the patients felt that the healthcare providers were more preoccupied with pushing pills and making money than actually giving the patients quality care. So they believe that it will actually hurt them more to actually go to the doctor than not go to the doctor. One possible solution to the distrust that many have with the healthcare system is what one article calls patient-centeredness and cultural competence. The power and importance of patient-centeredness is basically that it establishes and engenders an environment where the patient feels heard and the doctor does as well, which helps to improve care by helping to get to faster prognoses and improving the patient's overall rapport with their doctor. Cultural competence is more focused on addressing the disparities that minorities may face when attending the doctors and being treated, so that they can get quality care just like any other patient in the hospital.
Being an athlete, I have experienced hospital stays more times than I would like to admit, and I've also undergone surgery as well. I am very grateful that my family has the health care and the insurance that we need in order to take care of my siblings and I when it comes to a medical emergency. But in conclusion, I believe that our healthcare system needs to do a better job at protecting and helping those who are less fortunate and have less money. They still matter and they still need to be taken care of, especially with everything going on right now in the world. We are experiencing a national pandemic, a state of emergency. COVID-19 is wiping out thousands of people, and no one should have to suffer just because they can't afford to stay healthy.